Hi there, good afternoon. My name is Jennifer Rivera. I am a BSN 366-01 student, and today we're going to be going ahead and performing a central line dressing change. I'm going to go ahead and start by knocking on the door, entering the room. I'm going to go ahead and introduce myself to the patient, perform hand hygiene, explain the procedure we're going to be doing to the patient today. We're going to go ahead and be doing a central line dressing change. These are done typically every 7 days, sometimes sooner if there's any drainage, discharge, or if the dressing is becoming loose. I'm going to go ahead and ask my patient if they have any questions, and I'm going to go ahead and ask everybody in the room to go ahead and wear a mask, including myself and the patient. I'm also going to have my patient turn away from the central line while we're doing the dressing change. I'm going to go ahead and perform hand hygiene. I'm going to go ahead and don non-sterile gloves for the removal of the old dressing. Using my non-dominant hand, I'm going to go ahead and apply and hold the port in place while using my dominant hand to peel the old dressing off, making sure that port is not moving. I'm going to go ahead and discard my old dressing. I'm also going to go ahead and discard my non-sterile gloves. I'm going to go ahead and inspect the skin around the dressing, around the incision, making sure I don't take note if there's any redness, discharge around the area. I'm also going to take this time to ask my patient if they're having any pain, as discomfort is normal, but pain is not. My patient denies having any pain. I'm going to go ahead and move forward. I'm going to open my sterile dressing change packet. I'm going to start by donning non-sterile gloves. Using my non-dominant hand, I'm going to go ahead and slip 2 fingers into my glove, making sure not to make contact with the outside of the glove. Now I'm going to go ahead and slip 2 fingers into the glove, making sure to not make contact, and I'm going to go ahead and apply my sterile gloves. Now that my gloves are sterile, I am able to touch all the sterile material inside of my kit. I'm going to start with a chlorhexidine, which I'm going to crack open. I'm also going to use a gauze to hold the port in place while I scrub the area and the skin around the port. I'm also going to make sure I do clean the skin under the tubing line and around. We're going to go ahead and let this air dry. I'm discarding both of these. We're going to go ahead and not blow on this or fan it, allowing it to completely dry before going ahead and putting a new dressing on. At this time, I'm going to go ahead and place the dressing so we are able to see with the window towards the bottom. I'm going to go ahead and peel this away while anchoring down the line in place. There's also an extra piece on here, which is important to put on. On this piece, I'm going to go ahead and take a Sharpie or a pen. I'm going to go ahead and initial time and date, and I'm also going to add the size gauge of the port catheter. This is important to do as it will help the nurses coming on to shift to take over. I'm going to go ahead and doff my non-sterile gloves, perform hand hygiene, and that will conclude my video for today. Thank you so much for joining me. I'll catch you on the next video.